My name is Amy Dawson. I'm a neonatal nurse practitioner in Tulsa, Oklahoma. I've been practicing for almost 13 years as a nurse practitioner, and prior to that, I was a neonatal nurse and transport team member for approximately 7 years. I'd like to speak to you today about the current state of restrictions on nurse practitioner practice in the state of Oklahoma, specifically as it relates to our ability to prescribe certain medications for our patients. I thought I would start by putting it in perspective for you. As a neonatal nurse practitioner, I attend multiple deliveries for infants that range from 16 weeks premature to infants with multiple birth defects, different genetic syndromes. I am allowed to put those babies on ventilators if they need to be. I'm allowed to put central IV lines into their belly buttons. I can give them medications to start and or stop their heart. I can control their blood pressure. I can treat seizure activity. The thing that I cannot do is prescribe pain medication for my patients. Let's say you're an adult and you're driving through rural Oklahoma, I'm quite sure on your way to some other location, and you, God forbid, have a car accident or you have a heart attack. Odds are you will receive care at a rural health facility. A lot of those emergency rooms are staffed by nurse practitioners. Those nurses can treat your broken leg. They can treat the heart attack that you're having. They can give you nitroglycerin. They can interpret your EKG. They can refer you to a major medical facility for a heart catheterization. What they can't do is give you morphine to help you alleviate the pain of your heart attack or your broken limb. What I'm asking for is for the Oklahoma State Legislature to remove the restrictions on nurse practitioners' ability to prescribe medications in the state of Oklahoma. So I know what you're thinking. What's a nurse practitioner? What's prescriptive authority? In the state of Oklahoma, a nurse practitioner is a nurse who's achieved a master's degree in a specialty area of healthcare. For example, mine's in neonatal healthcare. Other nurse practitioners specialize in adult care, pediatrics, mental health, women's health, and geriatrics. What is prescriptive authority? Prescriptive authority is our ability to prescribe medications for our patients. In the state of Oklahoma, I have the ability to prescribe antibiotics, heart medication, neurological medication. I can run a code for somebody when their heart stops. But what I can't do is prescribe the pain medication they need to help provide a comprehensive health care for them, for my patients. To achieve prescriptive authority, I've had extensive education in pharmacology, which means the study of medications, how they work, how they affect the human body. To maintain my prescriptive authority, I have to have 15 hours of continuing education every 2 years in my area of specialty. In addition, I have to maintain at least 45 hours of continuing education every 2 years to maintain my overall national certification in neonatal health care. How does this restriction on prescriptive authority affect the average Oklahoman? Because Oklahoma is a predominantly rural state, we have a difficult time attracting and recruiting physicians into practice in the state of Oklahoma. In fact, approximately 50% of the counties in our state are considered medically underserved. That means there's not enough healthcare providers to provide care for the number of people that live in those counties. Per capita, Oklahoma has less than half the number of primary healthcare physicians of the national average. That means more and more Oklahomans are seeking health care from advanced practice nurses. Nurse practitioners are filling the gaps, if you will, in the healthcare provider shortage. What that means for the average Oklahoman is nurse practitioners are providing diabetes care, high blood pressure care, managing patients in hospice. Imagine if you were at the end of your life and you were trying to make healthcare decisions for yourself. You'd been seeing a nurse practitioner for several years, and you were told that you could no longer see that healthcare provider because he or she could no longer could not provide the pain medication you need to deal with your terminal illness. Several national organizations, including the American Association of Retired Persons, or the AARP, the American Nurses Association, the American Academy of Nurse Practitioners, and the Institutes of Medicine, in addition to the federal government, all support nurse practitioners being able to have full scope of practice for prescriptive authority. In addition to the support of these national organizations and the federal government, 15 individual states have already changed their nurse practice acts to allow full prescriptive authority for their nurse practitioners. Some of these states include Wyoming, Utah, and Idaho. So now the next question would be, well, how do we monitor all these additional people with the ability to prescribe potentially addictive medicines? My response to that is threefold. One, I want every nurse practitioner in the state of Oklahoma to apply for and receive a Drug Enforcement Agency number. This allows the federal government, the Drug Enforcement Agency, to monitor nurse practitioner prescriptions in the exact same way they monitor physicians. In addition to the DEA number, I want every nurse practitioner to increase the number of continuing education hours that are required for prescriptive authority from 15 hours every 2 years to 25 hours every 2 years. Finally, I want to maintain the collaborative agreements that are currently in place in Oklahoma. These collaborative agreements establish a relationship between a nurse practitioner and the physician of their choice. This means that a physician is available to that nurse practitioner 24 hours a day, 7 days a week, in case that practitioner has questions about how to appropriately care for their patients. These collaborative agreements are maintained and monitored by the State Board of Nursing, and anytime a nurse practitioner changes jobs, changes work locations, they have to reestablish collaborative agreements with a new physician in that area. Several studies involving thousands and thousands of patients have proven that nurse practitioners provide competent care on par with physicians. Our patient satisfaction and outcome scores, again, equal to physicians. Oklahomans have the right to receive competent, comprehensive health care. If an Oklahoman sees a nurse practitioner by choice or by necessity, they have the right to have their medical needs addressed. In order to adequately provide comprehensive health care, nurse practitioners in Oklahoma must be able to manage their patients' pain. Currently, we cannot do that with the state law in place. I call on the Oklahoma State Legislature to remove the restrictions on prescriptive authority for adequately educated and board-certified nurse practitioners in the state of Oklahoma. Thank you.